Healthcare has changed over the last few years, but we are still currently one of the only countries without universal healthcare.
Universal healthcare is when we pay more taxes in order to fulfill everyone's medical needs.
However, would universal healthcare be a positive or negative change to our country, and most importantly, its people?
But what is healthcare anyway? Healthcare advisor Jennifer Puentes knows the answer.
Healthcare is the ability for people to be able to find resources that they need in order to promote healthy well-being, both physically, mentally, and emotionally.
Universal healthcare is a broad concept that can be structured and funded in various ways. The common factor for all universal healthcare programs is that they require some form of government involved, whether it's through legislation, mandates, or regulations.
1.9 million Americans have chosen to come to the marketplace and get coverage for the first time. There were also questions about whether insurers would decide the marketplace is a good place to do business. And there are now 25% more issuers offering marketplace plans to consumers who can now choose from, on average, 40 health plans, which is up from 30 in 2014.
We asked beloved mayor of the city of Miami Springs, Xavier Garcia, in order to see what he thought would improve healthcare.
Well, I'd like to find a way where healthcare is available to everyone that can't afford it. Unfortunately, that means that we would have to have someone fund it, and that would mean the people, those of us citizens who pay through taxes to be able to fund that. So it's difficult. Sometimes what we want and what we get are two completely different things, but we have to try to find a way, because we can't have folks being out there without any health insurance or being able to have health care being provided to them. So I'm hoping that we can come up with an amicable solution where it doesn't cost the public too much money to be able to provide some health care to those people that can't afford it.
Peterson Kaiser Health System Tracker states health spending in the U.S. has grown at historically low levels since 2008, likely due to a combination of economic downturn and slow recovery, as well as structural changes to the health system like higher patient cost sharing. Projections published on health affairs by the Center for Medicare and Medicaid Services, CMS, however, suggests that health spending growth is picking back up, averaging 4.9% per year from 2014 to 2024.
First of all, I think we have the best healthcare system in the world. We really do, for those that can afford to pay for it. People come from all over the world to try to access our system, but yet it's very difficult for those that live here to afford our own system. So I think what we need to do is try to figure out a way to control the cost of healthcare and increase access, make sure that people have the ability to access the system regardless of ability to pay it out.
The only effect it's had on people who already had health insurance is they now have an assurance that they won't be prevented from getting health insurance if they've got a pre-existing condition, and they get additional protections with the health insurance that they do have. The costs have come in substantially lower than even our estimates about how much it would cost. Healthcare inflation overall has continued to be at some of the lowest levels in 50 years.
But is this really true? Maybe it affects more people than you know. We asked hairdresser Layla from Bonaparte how not having healthcare affected her.
I have mixed feelings. They have that in Brazil, it does not work. They have that in English, doesn't really work. I think what they're doing now is much worse. I had to pay $200 a month of penalty for not having health insurance. My sister is a single mother and she has to get insurance now because she cannot afford not to pay for the penalty. I think it's hurting a lot of people with no money. If you're on welfare and you don't have any money, it doesn't matter, you have it for free anyway. If you have a lot of money, it doesn't matter because you have money, but it's really hurting, in my opinion, the middle class.
I haven't had insurance for the last 7 years. I couldn't afford to have one. Regarding the universal care, it could be a lot of improvements, and I think one of those is that the government put some of the money into the healthcare system.
As the year progresses, so do changes in healthcare, both good and bad.
However, loyal citizens to this country are yet to acquire the medical treatments they deserve.
So which way will healthcare turn in 2016?